I have no connection to Mckesson or to Practice Partner in any financial sense by way of disclosure, but I have a long history, and so I'd like to just share a little bit of that history with you. I'm a family physician that's been in practice since 1978 after I finished my training at the University of Washington. But I actually asked to put in a plug for one, getting an EHR, and number two, this particular record as an opportunity. I mean, first of all, and I'm going to be very blunt, an EHR is the definition of modern medicine. It's the definition of 21st century medicine. The future is all about quality reporting and the ability to see in a way that goes beyond the old paper record. The ability to use your record when you're on call at night and go into it, the ability to have your record be something that is in the modern age. So unless you're like a few years from retirement, you will be, there's an imperative at some point in time to go to an electronic health record. And I believe that while that time has been there, for most of this decade, the time is really now. And actually, if you go to medscape.com, you can read my article on why you really should buy an EHR now. That the tool of the modern information age in medical care is the EHR, and it's happened in every other industry. I mean, can you imagine doing airlines where if you happen to lose your paper ticket, you couldn't get on the plane, or you were in a situation where you still only got your bank statement once a month in the mail and didn't be able to log into it and move money around or whatever. The future is patients having all or part of their own medical record or their own version. In this coming decade, the vast majority of Americans are going to expect to have their medical record in something that is their own medical home, if you will. And if you're not part of an EHR that has a PHR, a personal health record connected to it, you're going to be looked at as sort of practicing in the past. So I mean, that is a harsh reality. I trained at University of Washington, and a resident who was just under me is Andie Yuri. And Andie Yuri is the inventor of Practice Partner. So I go back to 1977 when I met Andie Yuri. And he developed a company called Physicians Microsystems in Seattle in 1984 and developed a record. He was an expert in MSDas. Some of you are old enough to remember MS-DOS, which was really a wonderful software until Windows came along. But MS-DOS had incredible logic to it and was the software that worked. And when I went in 1994, when I went to Sharp Healthcare in San Diego to start up a new residency program, I basically told Sharp I do not want to start with paper records. We must have an EHR, and I know what EHR we're supposed to have, and that's Practice Partner. Now, why would I say that? Back in the 70s, a pioneer of electronic medical records was the Medical College of South Carolina in Charleston. South Carolina had actually developed its own EHR and took a lot of pride in the 70s of being one of the few teaching facilities and clinics that actually had its own EHR. And during the mid to late 80s, they realized that their homegrown system could not compete with Practice Partner. And they actually gave up their homegrown system and went with Practice Partner and actually started a network of residency programs, and even there's the Practice Partner Research Network is actually run by the Department of Family Medicine at the Medical University of South Carolina. South Carolina is a long way from Seattle, but there's now many, many offices around the country that not only use Practice Partner, but if you want to be involved with their huge database of patient observation and research from real clinical practice, they have that. And so I launched in San Diego Practice Partner on the MS-DOS system. We used IBM 386 computers. This was before Intel and before Windows. And And that same practice is still on Practice Partner 8 generations later, of course, with Windows and modern computers. It's designed to be a very easy and intuitive system. Andie, when he developed Practice Partner, basically said the paper record is tabbed. I mean, a well-organized paper record has a tab for the problem list, it has a tab for medications, it has a tab for lab results, it has a tab for x-rays, it has a tab for registration materials, and the good paper record is tabbed. So basically, he created an electronic version of a tabbed record, kind of like almost like a restaurant menu where you go to the record and you find exactly what you want, and it's very logical and it's very organized. It doesn't look like some computer type of software that your eyes glaze over when you look at it. So you look at the record and it's sort of obvious. If I want to look at specialty consults, if I want to look at lab results, if I want to look at medications, if I want to look at progress notes, it's obvious where everything is. But the beauty is, and you'll see this, is like you enter something once, it's quite elegant. Your medical assistant will enter in the vital signs at any visit. And that's entered it once, but those vital signs actually immediately are populated in multiple places in the record. For example, the vital sign flow sheet. So if you want to look at the patient's blood pressures ever since you've been seeing them, if you want to look at the weights ever since you've been seeing them, what's happened, you just go there and all of a sudden, it's there in graphic detail, you can chart it, all kinds of things. So it sort of takes things in one place. You enter a medication, it's immediately put on the medication list. All of these things that make care, very efficient, very rapid. The most painful transition you will ever make in your career is the transition from a paper record to an electronic record. I will, it is this sort of window of hell, if you will, that you will live through. I've lived through it multiple times as I've gone on to multiple records. It gets easier every time, obviously, because they begin to make sense. And so you go through this, and you don't want to skimp on the fact that it's going to be a grind. And you want to make sure that all your docs become good users, maybe not super users. You want to have at least one super user in your office because they help teach the others down the road. But you make that transition. It takes 4 to 6 weeks before you feel like you're back, on the same amount of time and energy. And then, in another 4 to 6 weeks, you're way more efficient. You got way better records. And you've entered, modern information management medicine for your office. So you've grunted through a transition, it's a transition that I think if you're going to be in medical practice into this coming decade, you got to make it sometime. And Eisenhower is really interested, and it's going to use the Stark exemption and the high-tech funding to make it pretty financially relatively painless for you. So, that's pretty phenomenal support that, Debbie Bright and Eisenhower,